you. I hope I'm clearly visible, audible to you people. Let me confirm. Let me confirm in a second if I'm clearly visible, audible. I will start the lecture ahead. Give me a second to confirm it. Just a second. So yeah, I hope it is working. So I welcome you all for today's session. A very good morning to all of you. I am Dr. Priyanka Sachdev here, and today I am here to take a topic from systemic pathology from cardiovascular system. The topic for today is myocardial infarction. So we know that myocardial infarction is one of the ischemic heart disease, or you can say coronary artery disease. So ischemic heart disease or coronary artery disease, it is an umbrella term which contains four diseases under it, and myocardial infarction is one of the disease which comes under ischemic heart disease. So let me give you an overview of ischemic heart disease and let me come on MI. So topic for today will be myocardial infarction, MI. So MI is really very important topic for MCQs in all competitive exams in NEET PG, FMG, INICT, and also important topic for university exams also. So let me start with ischemic heart disease. So basically, what is ischemic heart disease? Known as IHD, ischemic heart disease, IHD, or also known as coronary artery disease, CAD. So IHD and CAD is one and the same thing, right? So let me tell you. So here is the definition of ischemic heart disease or coronary artery disease. There is imbalance between demand and supply of the heart. Now you should understand what is the demand for the heart and what is the supply of the heart. So demand and supply for the oxygenated blood, right? Demand and supply. Okay. Let me tell you. So can you see this is a diagram of the heart, a sketch rough diagram of the heart. You can see the four chambers in the heart, the left side, the right side. You can see this is the left ventricle. This is the left ventricle. I'm interested in left ventricle, the systole. So whenever left ventricle is doing the systole, the left ventricle is contracting. What is happening? The blood from the left ventricle is coming in the aorta. The blood, of course, it will come in the aorta, and via aorta it will be distributed. The pure oxygenated blood will be distributed in all organs of the body. So all organs, the oxygenated blood is received from the aorta when the left ventricle is contracting, right? So this is the supply of the heart. Heart is supplying blood via aorta by contracting the muscles of the left ventricle. Can you see? These are the muscles of the left ventricle. These are the muscles of the left ventricle. They will contract. They will do the systole and blood will come in the aorta and get distributed in all organs. That is the supply of the heart. But nothing is free in this world. For supplying, heart demands something, right? So supply is on the cost of the demand. So what is the cost? So for contracting the left ventricle, the wall of the left ventricle needs energy. It needs ATP, and ATP will be synthesized from oxygen, and oxygen will come via blood. So heart also requires blood. So from where heart is receiving blood? Can you see here in this diagram? From aorta, the coronary artery is coming out. Can you see this purple color artery I'm marking here? It is coronary artery. It is a bigger coronary which is known as conductance vessel, and from the bigger coronary, it is a branch of aorta only. From aorta, the coronary is coming out, and from this coronary, these small coronary arteries are coming out. These are known as resistance vessel. So these coronaries are supplying the wall of the left ventricle from outer to inner side. Can you see the coronary is supplying? So this is the demand of the heart. So this is the demand of the heart, and heart is receiving blood via these coronaries. So this is the you are supplying heart via coronaries, and heart is giving blood via aorta, right? So there is demand and supply, demand and supply, and there is a balance between demand and supply. Whatever blood you are giving the heart via coronary, so heart is receiving energy via that and contracting, and heart is giving the blood in the form of the aorta. So that is the demand and supply, and there is a balance between them. There is a balance between them. Now imagine a situation if the coronary got obstructed. Imagine this coronary got obstructed due to atherosclerosis, due to vasospasm, due to anything. So heart will receive less blood via coronary. Heart will receive less blood via coronary. That is, you are decreasing the demand, but you are expecting the same supply. No, it can't happen. If you are decreasing the demand, so left ventricle will get less, the wall of the left ventricle will get less blood, so it will do less contraction. It will receive less blood, less energy, less contraction. So it will give less blood in aorta. It will give less blood in the aorta. So that is decreased demand, decreased supply. That is known as ischemic heart disease. So if there is less blood in the aorta, all the organs of the body will receive less blood, right? They will receive less blood. So all our organs can undergo ischemia, right? And there is ischemia in the wall of the left ventricle because it is receiving less blood via coronary. So ischemic heart disease and coronary artery disease, because there is obstruction in the coronary. This disease is known as. So in short, there is a imbalance, imbalance between two things. What are the two things? Imbalance is occurring between demand and supply of the heart. So that is the short definition of ischemic heart disease. Have you got it? Give me a thumbs up if you got it. So it is an easier definition of ischemic heart disease. Let me see if I can see your chat. Yes, I can see. So, okay, let me come. So before starting the topic, I should tell you the blood supply of the heart in the form of the coronary. There are two coronaries. So to understand the blood supply of the heart, you should understand coronaries. There are two coronaries. Coronaries are the branch of aorta. Can you see? This is aorta. From the aorta only coronaries are arising. Actually, there are two coronaries, left coronary artery and right coronary artery. Right coronary artery is known as RCA. It doesn't have any further branch. It doesn't have any further branch. But left coronary artery have two branches. That is left anterior descending LAD and left circumflex LCX. So LAD, LCX are the two branches of the left, and RCA, that is right coronary artery with no. So total three coronaries are there. So what are the three coronaries? LAD and LCX are the branches of the left, that is left anterior descending and left circumflex, and RCA is the right coronary. So total we have three coronaries, two of the left side and one of the right side. Listen, now this is heart. You all can see the heart here. Imagine if I am cutting the heart from here. If I am cutting the heart from here and looking from above So what will happen? How I will see it? So okay, let me tell you. Okay, so let me take a blank page. Can you see this diagram? Okay. So if I'm cutting the heart from above, I can see the two cavities. This is the cavity of the right ventricle. This is the cavity of the left ventricle. So I'm interested in left ventricle wall. Left ventricle have four walls. Can I show you? This is anterior wall. This is posterior wall. This is anterior. This is posterior. This is lateral wall of the left ventricle. And this is medial wall. Medial wall is known as interventricular septum. So that is the medial wall of the left ventricle. Have you got it? These are the four walls. Total three coronaries are supplying the four walls. So let me tell you which coronaries supply which wall. Okay. So the anterior wall is supplied by LAD, left anterior descending. Please learn. Anterior wall is supplied by LAD, right? Lateral wall is supplied by LCX, the left circumflex. Posterior wall is supplied by RCA. It is supplied by RCA. What about medial wall? So we have three coronaries, three walls are supplied. What about the fourth wall, medial wall? So medial wall, the anterior two-third of the medial wall is supplied by LAD and posterior one-third is supplied by RCA. Have you got it? So the same LAD is supplying anterior two-third and same RCA is supplying the posterior one-third. So medial is supplied by both. So LAD and RCA. So this is how you have to learn it. You have to learn it. Now you should learn the sequence of their obstruction due to atherosclerosis. So there are three coronaries now. Most commonly atherosclerosis occurs in LAD, followed by RCA, and least common occurs in LCX. So if obstruction occurs in LAD, most common wall which undergo infarction is anterior wall because LAD supplies anterior, followed by RCA supplied by posterior, supplying posterior wall, and followed by LCX supplying lateral wall. So this is the sequence of the wall. In दोनों पे MCQ है. In the previous year question, you will find MCQ in both. What is the most common coronary and what is the least common coronary to get obstructed? What is the most common wall and least common wall to have infarction? जिस coronary में obstruction होगा, the corresponding wall supplied by it get ischemia. So ischemia and infarction. So that is the thing. So same diagram you can see here. Beautiful diagram. So you can see this is right ventricular cavity. This is left ventricular cavity. So you can see this is anterior wall supplied by LAD. This is posterior wall supplied by RCA and lateral wall supplied by LCX. That is the thing. So if you got it, so that is the same thing written here. Let me skip it. So these are the three coronaries with their supply. This is the sequence of their obstruction I already taught you. So on this many MCQs are there. Okay. So the entire disease is known as ischemic heart disease. If any of the coronary is obstructed, the supply is decreased, so demand will decrease. So there will be an imbalance between supply and demand, and that is known as ischemic heart disease, or also known as coronary artery disease. In ischemic heart disease or coronary artery disease, we have four diseases together. What are the four diseases we are having here? Number one, angina. Number two, MI. Number three, chronic ischemic heart disease. And number four, sudden cardiac death. Angina pectoralis, MI, myocardial infarction, chronic ischemic heart disease, CIHD, and sudden cardiac death. Sudden cardiac death, sudden death, sudden cardiac death. So these are the four diseases which come under coronary artery disease or ischemic heart disease. From this, today I will teach you only MI. So let me skip directly. I'm skipping the angina and coming directly on MI. Give me a minute. So MI is today's topic. So let me start with MI. So this is MI in front of you. Okay. So we have to study MI in these topics. You should know the definition of the MI. First of all, you should know the definition. What is MI? Myocardial infarction. So of course, myocardial infarction is the infarction. You know, infarction means coagulative necrosis. What do you mean by infarction? The coagulative necrosis of the myocardium, that is wall of the heart, due to decreased blood supply, due to obstruction in the coronary. So if coronary, any of the coronary, there are three coronaries now. So LAD, RCA and LCF, if any of them get obstructed, the corresponding walls, you know, if LAD is obstructed, it is anterior wall. If RC is obstructed, it is posterior wall. And if it is LCA is obstructed, it is lateral wall. So the coronary, if obstructed, the corresponding wall will undergo infarction. Infarction means necrosis. There are five types of necrosis: coagulative, caseous, liquefactive, fat, fibrinoid. It is the coagulative necrosis which occurs due to the obstruction. So this is the definition of MI, right? You can see the beautiful same diagram, the master diagram. Can you see the coronary? The purple color is the coronary here. Inside the coronary, there is atheroma. Please see here. There is atherosclerosis. So blood supply in the coronary is less. In the entire coronary, in all coronaries, blood supply is less. This is the blood supply. So can you see the wall, the heart wall, the wall of the heart? These are the cells in the wall of the heart. In the wall of the left ventricle, these are the myocardial cells. These cells are receiving less blood. So due to they receive less blood because coronary is obstructed, they undergo necrosis. Necrosis means cell burst. So a cluster of cell will undergo bursting in which wall? Anterior, posterior, lateral, it depends which coronary is obstructed. So that area is dead area in the wall of the heart. That particular area is dead area. So that is MI. So what is the reason for obstruction of the coronary? Why this coronary is obstructed? There can be three reasons. Most common is atherosclerosis, as I have told you. So most common reason is atherosclerosis. The second reason is the super added changes in the atherosclerosis, that is thrombosis, calcification. So thrombus can also obstruct, emboli can also obstruct, calcification can also obstruct. And the third is non-atherosclerotic causes is the vasospasm. Vasospasm of the coronary. The coronary undergoes spasm. So these can be the three reasons. Okay. Let me come on the type of the infarcts. What are the type of the infarcts? Okay. There are two type of infarcts. The name of the two type of infarcts is transmural and subendocardial. What do you mean by that? Now see here. The beautiful diagram. Please everyone see here. Can you see? This is atherosclerosis. Of course you all can see. This is the obstruction in the coronary atherosclerosis. So the coronaries are supplying blood where they are supplying blood. So the small coronaries are supplying blood. See the arrow from outer to inner side, from outer to inner side of the wall of the left ventricle. They are supplying from outer to inner. So if coronary got obstructed, the bigger coronary and small coronaries are supplying from outer to inner side. All small coronaries will receive less blood, right or wrong? All small coronaries. So which area of the left ventricle will be infarcted first? The inner area or the outer area? That is my question to you. The inner area or the outer area? Which area will be infarcted? So already the inner area, this area which is near endocardium, this is endocardium of the heart. So near the endocardium, the myocardium already receiving less blood because the blood supply is from outer to inner side. So अब तो कोरोनरी में एथेरोस्क्लेरोसिस हो गया है तो इसको और कम ब्लड मिल रहा है. So this area will undergo infarction first. So this area is known as subendocardial. So this infarction is subendocardial. Sub means नीचे, endocardial मतलब endocardium के. It is below endocardium. Subendocardial region. So it is in the myocardium but just below endocardium, subendocardial. And if the obstruction is continued, it will expand and involve the full thickness. The second type of infarct is transmural. So transmural is full thickness. Have you got it? So if I cut it from here and see from above, Let me take a slide and tell you. This is the two cavities. This is right ventricle. This is left ventricle, right? So if coronary got obstructed, so the inner portion is infarcted first. So infarct will start from here. Can you see? It will start from here, near the cavity, near the cavity. So this infarct is known as subendocardial. It is near endocardium, subendocardial, and it will expand, 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 and gradually involve the full thickness. So it is known as transmural. So the two type of infarcts are in front of you. So the first type is subendocardial. You can see it is near the cavity here. It is, can you see the yellow color? Near cavity, and gradually it will proceed, 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 and involve the full thickness. So it is known as transmural. The second type is transmural. And laminar is very rare. It can be random, random anywhere. So it is very rare. The third type. You can learn the two basic types. So the same diagram from Robbins, you can see the beautiful diagram. Here you see this is the coronary, it got obstructed. So infarct will start from the inner side. Please appreciate the infarct. It is starting from the inner side. Can you see this region? So this is subendocardial, and gradually it is proceeding, 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 and it is involving the full thickness. So it is transmural. This is subendocardial, this is transmural. So I have taught you the longitudinal diagram, also the cross-sectional diagram. This is cross-sectional, this is longitudinal. So I hope you got it. I hope you got it. So the two type of infarcts are transmural and subendocardial. Okay. So what is the location of infarct? Of course, it depends on which coronary is obstructed, as I have told you. So if it is LAD is obstructed, so anterior wall will undergo infarction, right? So the same diagram from the Robbins showing which wall is obstructed. You can see the three coronaries. Okay, one by one I will show you. This is anterior LAD. Can you see? This is LAD. Can you see? If LAD is obstructed, infarct is in the anterior wall. See, this is infarct. So this is LCX. If LCX is obstructed, infarct is in the lateral wall. And if RCA is obstructed, can you see? This is RCA. So infarct is in the posterior wall. So please appreciate the three infarcts. Anterior wall, this is anterior wall, this is lateral wall, and this is posterior wall. So depending which coronary is obstructed, that wall will get infarcted. Can you see? You can see this is right ventricle, this is left ventricle. This is right ventricle and this is left ventricle. The two cavities. I'm interested in the walls of the left ventricle. So the walls of the left ventricle, anterior, posterior, lateral. Medial may rarely it occurs. So that is the diagram. That is the diagram. Have you got it? And this is the complete obstruction. If partial obstruction is taking place, coronary ka, partial obstruction is taking place, anterior coronary, lateral coronary or posterior coronary. So the infarct will be subendocardial. The infarct will be transmural. Ye transmural tha, us taraf subendocardial. That is the thing. So let me move ahead. The most important topic which I want to teach you today in MI is the morphological features of MI. What do you mean by morphological features? Here I want to teach you two things. The gross in the morphology and the most important is microscopy in the morphology. You can't imagine how many MCQs are curated from this topic. So very few students can understand the morphological features in MI. Let me tell you, what do you mean by that? Why it is necessary for us to understand the morphological features of MI. Being a doctor, why it is necessary for us to understand the morphological features of MI. What do you mean by morphological features? Gross and microscopy क्यों समझना है? Okay, imagine there is a person. He is a person. He is dead. He is dead. The person is dead. There is another person who is claiming that is the cause of the death of this person is MI. That person just before the death, the person was having severe chest pain, and after having severe chest pain the person is dead, but the police is suspecting a foul play. The cause of the death is not MI, the cause of the death may be something else. So the body is there for autopsy, postmortem. So autopsy or postmortem, the forensic team doctor is doing the autopsy or postmortem. Just suppose I am the forensic team doctor and I am doing the postmortem of this dead body. So what is my job? My job is to find out whether the cause of death of this dead body is MI, yes or no, yes or no. So that is my question. Number one. So what I will do, I will open the chest of this dead body. I will open the thorax and take the heart out. Take the heart out of this dead body. So in the heart, if I take the heart out, I have to find out whether MI is present, yes or no. My first question. MI, the infarcted area, the scar is present, yes or no. Just suppose if I found the infarcted area, I found the MI. So grossly I have to see everywhere. पूरे हार्ट में, लेफ्ट वेंट्रिकल स्पेशली, because most of the MI occurs in left ventricle, anterior wall, posterior wall, lateral wall, in all three walls of the left ventricle I have to search for MI grossly. If I found out a small portion, tiny portion of the MI infarcted area I found out. So my second question is, being a doctor, a forensic team doctor, what is the age of MI? Age. What do you mean by age of MI? Just suppose maybe MI is present in the heart, but that MI is 5 years back, 10 years back, 20 years back, and now the cause of death is something else. Now the cause of death is something else. So I have to tell in my autopsy report what, whether MI is present or absent, and if it is present, what is the age of MI? So is it 4 hours MI or 4-month MI or 4-year MI? So what is the age? And we have to, so this is the age of the MI. This, the police will correlate the age with the time of the death. Just suppose MI is 4 hours old and the body dead, the death also occurs 4 hours back. So I will consider, the police will consider MI as the cause of the death. So we will see the age of the MI. So it is correlating with the time of death, yes or no. So two things I have to find out in a dead body. Number one, whether MI is present or not. Number one, infarcted area. And if it is present, what is the aging? Aging is really very important. So can we do the aging? Yes, we can do the aging. So we will make the slide of the infarcted area. And slides have different features at different ages. So that is the most important point for today. Have you got it? So the master diagram, you all can see, this is the master diagram from Robbins. In Robbins, we have divided into 10 zones. You all can see, here are the 10 zones. So I have drawn a simplified table for you people. This is the simplified table. What are the 10 zones in which I am dividing? So whether MI is 0 to half hour, 0 to half hour old, half hour to 4 hour, 4 to 12 hour, 12 to 24 hour, 1 to 3 day, 24 hours means 1 day, 1 to 3 day, 3 to 7 day, 7 to 10 day, 10 to 14 day, 14 day means 2 weeks, 2 to 8 weeks or more than 2 months. So I will show you 10 different diagrams on the slide, different diagrams based on which we can decide what is the age of the MI. Is the age is falling in this zone? Is the age of MI is in this zone? Is the age of the MI is this zone, this zone, this zone? And more than 2 years, it is same everywhere. It is 2 year, more than 2 months, it may be 2 year, 4 year, 10 year, 20 year, whatever. More than 2 months, it is scar only. It is a scar. So that is the thing. So what is the age of MI? I will show you in 10 different diagrams. The 10 different ages are there. You can see, right? So before coming on these diagrams, let me teach you the gross. Now, why gross is important? Why gross is important? Okay, let me take a, so this is the heart from the dead body. So I have taken out the heart from the dead body. This is the heart. You can see the 4 chambers. How I will find out where is MI, where is the infarcted area? So what I will do, I will cut the entire heart in slices. 0.5 centimeter thickness की slices में I will cut the entire heart in multiple slices. In multiple slices. Okay, I got it. Then after that, I will take each and every slice. This is each and every slice. This is right ventricle. This is left ventricle. In the walls of the left ventricle, I will look for MI. I will look for the infarcted area. Where is MI? Where is MI? So it can be here, it can be here, it can be here, anywhere it can be present. So in each slide, I have to look it for it with the help of a magnifying glass. So it is a very difficult job. You will say, ma'am, a number of slides are there. And we, using a magnifying glass, we have to look for a small infarcted area. So sometimes there is a chance we can miss it. Yes, of course, there is a chance we can miss it. So what we will do? What we will do? So there is an easy thing for that. So we will take a flask. We will take a, you can say a flask or a basket, a bucket. It is filled with a dye. The name of the dye is TTC. What is TTC? Okay, I will tell you the full form of TTC. So TTC is a dye. It is tetraphenyl tetrazolium chloride. TTC. We will fill it with TTC. And all the slices which I have cut here, you can see this is the heart. I have cut the entire heart into multiple slices, right? So all the slices I will put here in this and keep it there for 2 to 3 hours. 2 to 3 hours. After 2 to 3 hours, I will take all the slices and wash them. I will wash them. So what will happen? Now just suppose this is a slice. This is the right ventricle. This is the left ventricle, right? And this is the infarcted area. Let me draw the infarcted. This is a small infarcted area in the anterior wall. In the anterior wall. Can you see the yellow area? This is infarcted area. So entire slice will take the red color. the viable area will take the red color of the dye. Dye is of red color, and all viable area will take the red color, except the infarcted area, which will not take the red color. It will remain pale yellow only. It will not take the red color. So we will see the all slices again. So all slices will be red. The area which is yellow, that is the infarcted area. So it is an easy way to find out using a dye known as TTC, tetraphenyl tetrazolium chloride. Triphenyl tetrazolium chloride, TTC. The full form of TTC. You can see the best diagram from the Robbins. Beautiful diagram showing the two, this is left ventricle, this is right ventricular cavity, and see this yellow area. The rest of the wall is red except this yellow area. Here also you can see, appreciate this yellow area. The rest of them is red. You can see the cavity, you can see the red area. So viable area, viable, okay, let me write it. The viable area is red and dead area, non-viable area is yellow. So viable is red and non-viable is yellow. Why? Why? The question is why. What is the principle? Why TTC is giving red color to viable and yellow color to dead? The question is why. Okay. To answer it, it is very easy. You know the entire wall is made up of cells. So let me draw a few cells here. These are the cells. These are the cells of myocardium. Entire wall is made up of cells. Right. So this is the dead area. In dead area, the cells are already burst. They are necrosed. They are burst. So here the cells are bursted cells. In this area, the cells are bursted. Now all the cells have an enzyme known as dehydrogenase inside it. Dehydrogenase enzyme is present inside the cells. So TTC form a bond with dehydrogenase. So all the area which have intact cells, dehydrogenase is present and TTC will form a bond with it, and that area will become red. But the dead area, the necrosed area, the dead area, the cells are already burst. The cells are already burst. So dehydrogenase is leaked out in the blood. There is no dehydrogenase. So this area will not take the dye. It will remain pale yellow. So a good contrast between the dead and viable area. Give me a thumbs up if you got it. Have you got it? Give me a thumbs up. So that is about the gross. So grossly how you will find the dead area. So this is the dead area and I found it on the gross. So what is the next step? So I will cut this area and make a slide of it. Make a HNE slide out of this area and I will see the slide. So based on the different morphological features, I will decide the age of the MI. So MI is present. It is decided grossly only. But what is the age of MI? We cannot decide it on gross. We have to decide the age of the MI on microscopy. On grossly, we can decide whether MI is present, yes or no. But to decide the age of the MI, we have to perform the microscopy. For that, we have to make the slide of it. So there are 10 time zones. So I will tell you 10 different slides, right? So it's very easy. First understand, then I will teach you the theory one by one. So this is the easy table from, Robbins. I have decoded this table for you. So you can see, okay. So from 0 to half hour, it is normal. It is normal. It is same. So from 0 to half hour means 30 minutes. Up to 30 minutes, it is reversible injury, you can say. Up to 30 minutes, the injury is reversible, right? From half to 4 hour, waviness is there. See the lower half of this diagram. Please everyone see the lower half of this diagram. So you can see the waviness. You can see the waviness. The fibers, these are the myocardial fibers. They undergo wavy. They are normally they are straight, but now they undergo waviness. So half hour to 4 hour, they are and otherwise they are normal. You can see the nucleus on them. You can see the striations. These are the striations. Light and dark striations are there. So otherwise they are normal. Only waviness is there. From 4 to 12 hour, coagulative necrosis is there. You know, coagulative. Now see the upper half of this diagram. See this diagram. So please see and compare. Compare the myocardial fibers in the lower half and in the upper half. Please see, I'm drawing here. The myocardial fibers mean the nucleus is disappeared from all of them and striations also disappear and they are dark pink color. They all become dark pink color. So that is they undergo coagulative necrosis. So coagulative necrosis in all the fibers. So waviness आया पहले और waviness के बाद they undergo coagulative necrosis. Have you got it? So next feature is coagulative necrosis. Please give me a thumbs up. It is coagulative necrosis. Next feature is coagulative necrosis. Give me a thumbs up. Give me a thumbs up. From 12 to 24 hours. Next is 12 to 24 hours. From 12 to 24 hours, it is, okay, just a second. You can see coagulative necrosis is already there, but along with coagulative necrosis, you can see the neutrophils also. Few neutrophils are coming. Please appreciate these are multi-lobated cells, which are the neutrophils here everywhere. Neutrophils are there. So coagulative necrosis along with neutrophils. Just a second. Okay. So coagulative necrosis along with few neutrophils. From 1 to 3 days, coagulative necrosis is still there, but many neutrophils will come. See this diagram. See this. So coagulative necrosis is there, but please appreciate these all neutrophils. These all. So it is brisk neutrophils. Brisk neutrophils. Coagulative necrosis, पहले few थे, अब brisk हो गए. Neutrophils are there. From third day onwards, neutrophil will decrease and macrophage will increase. So neutrophils start decreasing and another cell macrophage are coming. Please see, everyone appreciate I am marking macrophages. So this cell, this cell, this cell, this cell, this one, this one. I can see these are the macrophages in this slide. I guess in the slide, these are the macrophages. So neutrophils start decreasing and macrophages start appearing. What are macrophages? Macrophages are the phagocytes. They will eat the dead muscle. They will eat the dead muscle, the coagulated necrosis wala muscle, they will eat it. So gradually they will start eating the muscle from everywhere. And instead of muscle, granulation tissue will come. So the next step, from 7 to 10 days, from 7, granulation tissue will appear, start. That is dead muscle will be going, coagulated necrosis is eaten up by the macrophages and in place of it, granulation tissue will come and from 10 to 14 days, it will be the well established. So can you see this diagram? It is all granulation tissue. See the lower half. It contains coagulative necrosis fibers. So it is the dead fibers. They are eaten up gradually by the macrophages and it is replaced by granulation tissue. This whole is granulation tissue. So background contain the collagen along with the blood fibers, few eosinophils and fibroblasts. So this is coagulation tissue, granulation tissue. So granulation tissue and finally collagen and scar will be there. Everything will disappear and only scar tissue is there. So in the end, we get the scar, only scar. So this is the whole table in front of you. I guess it is very easy. You have to learn this table and you have to help me in making this table. Let me revise it. So 0 to half hour, half to 4 hour. It is R, huh? R. 4 hour to 12 hour. 12 to 24 hour. 24 hour means 1 day. So 1 to 3 day. 3 to 7 day. 7 to 14 day. 14 day means 2 week. So 2 week to 2 month and 2 months onwards. So these are the 10 zones are in front of you. Let me write it. So first of all, it is normal. You get nothing. It is normal. It is reversible up to 30 minutes. Then you start getting changes. The first change is always waviness. Half to 4 hour, it is waviness. Waviness. Learn the time zone corresponding. 4 to 12 hour, only coagulative necrosis. Only coagulative necrosis, right? After that, coagulative necrosis के साथ coagulative necrosis के साथ neutrophils are there, but initially few, later on brisk. Later on brisk. Have you got it? Have you got it? Now from third day coagulative necrosis के साथ we get macrophages also. Macrophages. The macrophage will appear. Neutrophil will decrease and macrophage start increasing. Macrophage will eat the dead muscle. So here is the granulation tissue. Granulation tissue. Early granulation tissue and established granulation tissue. And last में आएगा scar. The last thing is the scar. So that is how you have to learn it. One more important finding here which I want to highlight is that neutrophils first time appears at 12 hours and macrophage first time appears at 72 hours. 3 days means 72. So 12 hour पे neutrophil आते हैं और 72 hour पे macrophage. इस पे बहुत MCQ आएगा. You will find multiple MCQs on it. Give me a thumbs up if you got it. So please learn this table. This is the master table from which multiple MCQs will come. Multiple MCQs will come in your exam, right? So, okay, let me move further. So we have already done the revision. So, okay, so there are few polls based on it. Okay, you have to write your answer in the comment box if you know the answer. I will launch the question in front of you and please write the answer based on this master table. Please everyone participate. Huh? Write your answer in the comment box. I can see your comments, I guess. Yes, I can see your comments. Okay, so please read the question. I will read the question for you. Reversible injury in myocardium. Up to how many minutes or hours it is reversible? Is it, the options are 2 minute, 30 minute, 2 hour or 5 hour? Reversible कब तक होता है? Reversible means normal. So after MI, reversible कब तक होता है? It is reversible till what time? Is it 2 minute, 30 minute, 2 hour or 5 hour? I have told you the entire table now. The first zone is 0 to half hour. 0 to half hour is normal. So half hour means 30 minute. Yes. So you all are right. The correct answer here is 30 minutes. So up to 30 minutes it is absolutely normal. So give me a thumbs up. Give me a thumbs up. So up to 30 minutes it is absolutely normal up to 30 minutes. Okay. Let me move further. So this is the next question. So up to 30 minutes it is normal. See. So the answer is 30 minutes. Have you got it? See the next question. Very good question. So let me read it. During autopsy, that is postmortem, of a patient died due to suspected MI. Of course, we do MI of a dead person. So of a person dead due to suspected MI, I am doing the autopsy. The heart is stained with TTC. TTC, triphenyl tetrazolium chloride. So this dye, I have stained the heart. So what is the color of viable myocardium? I'm not asking dead. I'm asking viable. Viable का color क्या होगा? What is the color of the viable? Please write in the chat box. What is the color of the Bible? So yes, welcome Singh. You are absolutely right. Is it blue, white, red or dark brown? So the answer I will go here is red. So red is Bible. Bible have red color because of the enzyme having dehydrogenase inside it. And instead of Bible, if I ask non-Bible in the same question, non-Bible or dead, then the answer will be yellow, but yellow is not there in the option, so I will go with white or yellow will be there, non-viable. But here viable is asked, so correct answer will be V. Welcome, you are absolutely right. Good. So everyone should participate. Correct answer here is C. Very good. So you can see the whole viable is red in color and non-viable is yellow in color. So red and yellow, and you know the principle behind it, the enzyme dehydrogenase, right? The next question in front of you, please read it. Next question, I will read it for you, then you have to tell me the correct answer. A 45-year-old male is there having severe chest pain. Okay, imagine a 45-year-old male is coming in your hospital, in your clinic, and the person is having severe chest pain. You admitted the person to the hospital and you have made a diagnosis of acute MI. You have done the ECG, you have done the enzyme markers in the blood, and your diagnosis is acute MI, and you have admitted the patient under you, right? 4 days after admission, he is dead in the hospital. So after having the episode of MI, at fourth day, the person is dead and you are doing the autopsy. You are doing the autopsy at fourth day. The same day the person is dead. Of course, autopsy is done on a dead body, right? So, जैसे ही person मरा, on the fourth day you are doing the autopsy. So here the clinch in the question is day 4. So day 4 पे autopsy पे क्या मिलेगा? Day 4 पे autopsy पे क्या मिलेगा? What you will find in the autopsy? Do you find fibroblast and collagen in the autopsy at fourth day? Fourth hour नहीं है, fourth day है. Do you find granulation tissue? Do you find neutrophils with coagulative necrosis? Do you find granuloma? What you will find? What you will find at fourth day? What you will find? No, it's not D. Welcome. Welcome. Are you saying D for this question? It is not D. I guess you are saying D for the last question. For the viable I have asked now. So no. For this question, welcome. You tell me what is the correct answer. What is the correct answer for this question? Please, everyone tell me. So, okay, macrophages आएंगे. Ananthaman ST, I got it. At fourth day, macrophages will come. Okay, you are absolutely right. At day 4, but there is no option having macrophages. So what is the best answer you can go here? What is the best answer? Ananthaman. Macrophages is not granuloma. Granuloma is something else. Granuloma is not formed in MI. MI is not a granulomatous disease. Tuberculosis is a granulomatous disease. Tuberculosis, leprosy, you know, वो granuloma अलग होते हैं. MI में there is nothing like granuloma. तो granuloma तो होते ही नहीं है. In entire 10 zones मैंने कहीं भी granuloma नहीं बताया. I have not told you granuloma anywhere. So yes, welcome Ananthamudan. You both are right. The best answer here is C. C में क्या option है? Neutrophilic infiltration with coagulative necrosis. C. Day 4 is asked, right? So where is day 4? इस zone में आएगा day 4. 3 to 7 में आएगा day 4. Day 4 is asked in our question. So best अगर options में हमें ये मिलता तो it is best if you find this in your option, that is neutrophil along with macrophages, but none of the option contains macrophages, right? See, collagen and granulation tissue कब आता है? Collagen is coming here. It is 2 to 8 week, that is 14 days onwards, right? We are asking for 4 days. The examiner is asking for day 4, not for day 14. So collagen is wrong. Scar is after 2 months, that is 60 days. 2 months means 60 days. So 60 days be wrong. In our question, 4 days is asked. not 14 days and 16 days. So these two options are wrong. This is at 14 day, this is at 60 day. This is at 14 day and 60 day, right? So these two options are wrong. Granulation tissue and collagen and scar is wrong, right? Granuloma to hota hi nahi hai. So the only option we are left is neutrophilic infiltration with coagulation tissue. So neutrophilic infiltration, see here, neutrophilic infiltration with coagulative necrosis, it occurs at day 3. In the question, day 4 is asked, but it is near. Day 3 or day 4 chalega. Instead, day 14 or day 16 nahi chalega. So the closest answer is this. Closest. I know this is not at day 4. It is at day 3. I know day 3 pe hai, but day 4 is asked, but it is the closest. The rest of the days are farther. I guess you got my point. Give me a thumbs up if you got my point. Welcome Singh and Ananthamon, please give me a thumbs up, and others also, those who are listening. So this is how you have to approach the question, right? So correct answer here is C. Very good. This is the next question. I guess everyone will be right here. It is the easiest one. So please everyone participate. Okay. So both of you welcome. Ananthamon, please answer this question. What is the earliest feature of MI? Earliest. The four options are in front of you. Please tell me, is it macrophage which come earlier? Is it the neutrophil which come earlier? Is it the waviness or coagulative necrosis? What comes earliest? So yes, you both are right. Welcome and Ananthamon. You both are right. Very good. The correct answer here is the waviness. My next question to both of you and others also, those who want to answer, please make a sequence from earlier to later. Fastest finger first. Please make a, is it ABCD, CBDA, DBAC? What is the sequence? From earlier to later. तो इसको पहले से बाद की तरफ सही क्रमांक में, इन द सही सीक्वेंस, करेक्ट सीक्वेंस, प्लीज अरेंज इट. So what is the earliest? First, you told me the first is this one, waviness. What is the second? Waviness के बाद क्या आएगा? So Anantha Motan, you have already answered it. After waviness, the second is coagulative necrosis. Very good. After that, there is coagulative necrosis. Coagulative necrosis के बाद what is the third feature? Is it neutrophil or macrophage? So first neutrophil comes at 12 hours and then macrophages come at 72 hours. So correct sequence is C, D, B, A. So C, D, B, A, you all are right. Very good. So C, D, B, A is the correct answer. C, D, B, A is the correct answer. Very good. So this is how multiple questions can be framed from a single question, and you should be prepared for all. It is not the same question which will come in your exam. The same aisa kaisa earliest aa gaya. No, it can come anything in any form. So your mind should be, prepared for all new questions. You should know the entire knowledge. सब कुछ पता है, क्वेश्चन कुछ भी फ्रेम हो जाए, you can solve it. So if you know the concept, you can solve any question, right? Yes, so this is the correct sequence and you both are right. Very good, very good. So this is the same table. Okay, so this is the next question in front of you. Easy one. So a myocardial infarct is there, MI is there, showing early granulation tissue. Early granulation tissue कब बनता है? When it is formed. I'm asking about early, not established. Granulation tissue जब बनता है, when macrophage come, they eat the dead muscle, they eat the coagulative necrosis. So in place of dead muscle, granulation tissue appears. So first time granulation tissue किस point पे आता है? Is it less than 1 hour or 24 hour or 1 week, that is 7 days, or 1 month? 1 month. 1 month is 30 days. So when it will come? So what is the correct answer here? So what you will say? Correct answer ABCD में से क्या है? 1 week. Ananthumon, you are saying 1 week. Maybe. Let's see. Anyone else? Welcome. What do you say? Anyone else? What do you say? So yes, the correct answer here is 1 week. So you know the table. So you know the table. The correct answer, granulation tissue first time. See here, at early granulation tissue and then advanced. So early is asked in the question. It is coming at 7 to 10 days. So is 7 to 10 days there in your option? 7 to 10 day hai kya? 7 to 10 days not there in the option, but 7 day exact is there. So best answer here is C. So 7 to 10 days the exact answer. एग्जैक्ट आंसर है 7 to 10, लेकिन 7 to 10 नहीं है ऑप्शन में, तो आई विल गो विद 7 ओनली. 7 डे, ये तो 30 डे हो गया, ये आपका 24 आवर यानी 1 डे हो गया, और ये तो 1 आवर हो गया. सो 7 to 10 डे में से क्लोजेस्ट इज दिस. So correct answer here is C. Give me a thumbs up. No, welcome Singh. The correct answer is not B, it is C. Have you got it? Give me a thumbs up. Give me a thumbs up. So that is the thing. The next question in front of you. You tell me what is the correct answer. Okay, leave this. It is a confusing. Here two options are correct. Okay, write down two options. So what is my question? Let me read the question first. In MI, coagulative necrosis with neutrophilic infiltrate occurs at what age? So I'm asking coagulative necrosis along with neutrophils. But the clinch in the question, I have not mentioned whether few neutrophils or brisk neutrophils. So if I ask few neutrophils, answer will be different. If I ask brisk neutrophils, answer will be different. So you know the two options. The two options is B and C. If I say few neutrophils, answer will be B. And if I say brisk neutrophils, answer will be C. So 12 to 24 hour and 1 to 3 day. You can see here. So you can see here, just a second, coagulative necrosis with few neutrophils 12 to 24 hour and brisk neutrophil 1 to 3 day, and both is given in the option. And in the question I have not mentioned few ki brisk. So both options are correct. So technically if you speak, both options are correct. So the question is wrong. You know, if it is a PGI, I can mark both. So both are correct, right? But in the question, the examiner should mention whether examiner want answer for few or for brisk. So answer is different for both. For few, B is the answer. For brisk, C is the answer. Give me a thumbs up. Give me a thumbs up. So that is the clinch in the question. But if this question is actually coming in your exam, kya karoge? What you will do? You cannot stand and say the question is wrong. Please change the question. You cannot do that. So what is the best you can do at that point? Imagine the situation if it is really coming in your exam. The same question, same option without any change. So if I was at your place, I will go with the brisk. तो few का chance नहीं लेंगे. Few में it will appear 1-2 neutrophils. Brisk में there are numerous hundreds of neutrophils. So I will go with brisk. So I will mark C. I know B and C both are correct, but if one has to be marked, I will be sure कि जिसमें ज़्यादा हो neutrophils, brisk neutrophils. So I will go with C. So okay, yes. So I will also go with brisk, Anantamutan. So correct answer here is C. It is given in most of the books, but B and C both are correct, right? So that is the approach. That is your approach. Okay. The next question in front of you: the cells which are seen after 72 hours. After 72 hours, which cells are seen after 72 hours? I have told you very clearly. 72 hours के बाद कौन से सेल आते हैं? Which cells come after 72 hours? Neutrophil, lymphocyte, macrophages, or monocyte in MI. I'm asking about MI only, of course. The correct answer here is, of course, you all are right. It is macrophage. Don't say monocyte, Welcome Singh. Monocyte will come. Monocyte are known as in blood. Once they come out of blood inside the muscle, in the tissue, they are known as macrophages. I know both are same, but go with macrophages. So you can see here at 72 hours. 72 hours means 3 days. So at 3 days, macrophages are appearing. Macrophages are, neutrophils are already there. They will decrease after 72 hours and macrophage will appear. So correct answer here is C, right? The next question, the cells at seen at 48 hours. 48 hours means 2 days. 2 days पे एक ही सेल होते हैं. कौन से सेल होते हैं? Polymorph, fibroblast, lymphocyte और macrophage. Which cell will come at 48 hours? You want to see the table? See the table. 48 hours पे कौन से आते हैं? You tell me. 48 hours कहाँ है? 48 hours means 2 days. So 2 days ये रहा. So 2 days पे we have brisk neutrophils. So go with neutrophils. Neutrophils are polymorphs. So go with A. Polymorphs and neutrophils, one and the same thing. Same thing. Have you got it? So I'm done with the morphology. So main was morphology and many questions are on that. So I have to stop here as the link is expiring. Time is limited. Okay. So thank you very much for being with me. I really enjoyed teaching you. Hopefully same from your side also. Maybe you have learned the topic MI well, and especially the morphology, pathological features. So my next class will be tomorrow. Tomorrow I am taking a class on GIT of pathology. So I will start in GIT. The topics will be, yeah. So many topics are there. So many important topics of the GIT will be there tomorrow covered. So tomorrow morning at 9 a.m. again daily at 9 to 10 a.m. in the morning, you will have a class with me where I will teach you a very important topic from the pathology for your NEET PG preparation. So please be with me every day in the morning on YouTube, the same channel, 9 to 10 a.m. in the morning. So for the newcomers who don't know about the paid subscription of Unacademy, on Academy we have 2 paid subscription, Plus and Iconic. In Plus you will get access to live and recorded lectures of Unacademy only. In Iconic, along with Unacademy, you will get access to Prep Reader also. So better to go with Iconic. So if you take a paid subscription, these are the features you will get, access to all these batches and features. And you can check the various plans along with various prices of various plans of Plus and Iconic on your app. Whatever plan is comfortable to you, according to your wish, you can, according to your need, you can take that subscription. The exciting news is that whatever subscription you are taking, if you apply my code, that is Sachdev10, before payment, you will get straightforward 10% discount. So please learn the code Sachdev10 and take the benefit of these subscription. Thank you very much. I'm ending.